Good morning.
Good morning.
Roland. Welcome to 1 Million Cups. I see 11 new faces out there. Glad to have you this morning. I'll jump right into the slides because I know we've got a packed presentation. These are some of the organizers here at 1 Million Cups. So if you are new, we are always looking for presenters. Find one of these beautiful faces and let them know you'd like to present or you know somebody that would like to present. And thanks to our sponsors. Big thanks to Union Station Deli. They're sitting at that table. Big thanks to them for allowing us to be here this morning. With that, I'm going to welcome pre-market position on up.
Woohoo! All right, I'm Dr. Joseph Sheppard, pre-market position clinic, and I want to talk about a couple of principles that underlie what it is that we're doing. Okay? First principle, this is an interesting study that came out in 2003 out of the New England Journal of Medicine, and this has been used to justify a lot of actions, my actions and the actions of other people. This study compared the cost of Canadian healthcare to the cost of American healthcare and came to the conclusion that American healthcare costed a whole lot more because of administrative expenses. And so this study was a lot of the firepower that propelled the Affordable Care Act when it finally came out. This study is also a study that kind of propelled what it was that I decided to do, because the American healthcare system, the cost of running the funding through health insurance is massive. As of the time of this study, the cost was somewhere around 30% of every dollar that went into health care was consumed by the insurance billing process. And this was way back in 2003. With everything that's happened since then, that amount is much higher. The time expense, the actual loss of dollars. And so, one group of people ran with this and said, all right, let's go to a single payer system. They tried to push it that way. Another group of people said, well, let's just get rid of this health insurance thing altogether. So that's the first principle that kind of undergirds what we're doing. Second principle is the proper role of health insurance. So if I could take anyone can just shout it out. What is health insurance for? Say it again?
Major catastrophes or...
Okay, so to pay for major catastrophes. Anyone else? That's a great definition. Anyone else have another definition?
Supposed to save you money on expenses.
Save you money. Save you money. Do insurance for protection. Yeah.
So it's like you purchase it to protect you in case you have a lot of health expenses. Normally they want the healthy, right? Because they don't have as much health expenses because you have the co-insurance to think about.
Yeah, and this is where it starts getting complicated. So the real ideal purpose of it is to insure against, like Jennifer said, against unexpected expenses that you can't afford. And the purpose of it is to protect your
Assets.
your finances. Yeah, your assets. Yeah. So is the purpose of health insurance to protect your health? No. The purpose of it is to protect your finances against unforeseen catastrophic health events that would negatively impact you financially. And so the question is, if that's the real purpose behind it, what is it that we're purchasing? Are the products that we're purchasing in the health insurance world, are they protecting our finances? What do y'all think? No. Okay, I agree with that. Okay? So, the products that we purchase are not catastrophic products. They are products where we're trying to fund the entire health model. So let's think about the impact of this model if we impose that on car insurance. Okay? What would happen to the price of car insurance if that was used to pay for gas, tires, repairs, and oil changes?
Nobody would have insurance.
Yeah, no one would have insurance. Would it get more affordable? No. Would your average cost per gallon of gasoline go down? No. All you're doing is you're adding this layer of administration and manpower and this billing process onto it that's only going to drive up the cost. Okay? Okay, what about this? Let's say that we all were using those plans, but the government came and said, well, let's make these plans mandatory and let's sell them on exchanges. Is that going to make it any more affordable? No. And so once again, proper role of health insurance is to protect our assets against unforeseen medical expenses. There's the second principle. All right, third principle. You work for whoever pays you, okay? This is well established in business and in the Bible. No man can serve two masters. He's either gonna love one and hate the other, or he'll hold to one and despise the other, okay? You work for whoever pays you. Who are physicians working for right now? Insurance companies, yes. And so we have a care model. I'd like to introduce you to your American doctor. For every hour spent with patients, physicians spend 2 hours on electronic health records and desk work, according to a recent study. So are your physicians working for you, or are they working for someone else? And what is the impact of that? Well, the impact of it is that you got a bunch of people that went to medicine to help people, and instead they're working for insurance companies, and we are having major issues in the industry. Physician burnout is the hot topic these days in the medical industry, how to avoid burnout. And so you go to conferences where they're telling you how to avoid burnout, but you're still working 8 hours a day seeing patients and then doing charge for 4 hours in the evening. Like all these little time-saving devices and things don't work when the system is fundamentally flawed. So, I went to medical school. I started in 2007, graduated in 2011. And I had gone to medical school with the idea that I wanted to open a cash-only clinic. I was a journalism major and was covering health insurance reform and wrote a medical economics blog all the way through medical school. And so my whole goal was to do cash clinics. And so this is the mission of our clinic. So Free Market Physicians seeks to make superior primary care personally affordable for working Americans and provide long-lasting and fulfilling careers to physicians and nurses through the implementation of the direct primary care model. Number one, we can make superior primary care available because we work for our patients and not for somebody else. And number two, we can make it personally affordable to anybody with a job because the cost of the model goes down so much when you cut the insurance billing process out of it. And so it's our hope to make this more available in a more widespread manner. And so how does it work? So one, patients pay us directly for their care. There's no middleman there. Then the patient selects some sort of insurance product that actually does protect their assets. And then we work directly for them. And so the end outcome is superior care, lower cost. That's us. So in function, how does this work? So our patients are part of a membership plan. They have a physician that they're established with. They have guaranteed same-day visits with us. We have guaranteed on-time visits. If our patients are seen more than 10 minutes late, they get a partial refund. They get their labs and medications at cost, and they have direct access to their phone, their physician 24/7 by phone, text, and email. And then this is the pricing that we have. One of the hardest things for me is I grew up in a household where we were real economical on everything that we did. And so I had planned to do kind of a fee-for-service model where a patient comes and they pay $70 a visit and go. But that is an urgent care. That is an urgent care. And in primary care, we're actually trying to do maintenance. That model discourages patients from actually getting the medical care they need. And in the end, you're burning them. And so we ended up going to this membership model instead, so a patient can see us as often as they need to. There's no charge for any visits, and if anything, we're encouraging them to come in and get the care that they need. So, who stands to benefit from this type of service? Well, we're trying to make this affordable for everyone, but there are certain groups of people that this works particularly well for. Individuals and families who are purchasing their own health insurance. If they're not just being provided it by the government in the form of like Medicaid or by an employer, then they're out there bargain shopping, and we can really help save them money. Number two, individuals and families who use ministry plans. So the ones that people hear about are plans like MediShare and Christian Healthcare Ministries. Those plans are essentially budget, high deductible plans, and so we slip in as the primary care, and we help make sure that the individuals that are with us that are on those plans are not running to the hospital all the time. And so those two products go really well together. Third group, busy professionals that don't have time to wait hours to see a doctor. If your time is worth something, then you don't have time for the American medical system, and we're the people for you. We guarantee those on-time visits. Our patients are able to access us by text, phone, and email. And so anytime we can turn a visit into a phone call and not drag into the office, we do that. Another group, just people that prioritize your health. If you're really serious about your health, or if you have something that you're worried about, a lot of times you don't have time for the American medical system. You need a doctor who's at your beck and call, who's really going to take care of you. You don't have time to call in sick to a clinic and be told, well, the physician's booked out for 2 weeks. And when you actually show up, wait 3 hours to actually see the physician, your health is too important for those delays. On the business side, small businesses that can't afford traditional health insurance, we're a really good fit for them. You know, if you can't afford $300 to $400 a month for an employee for a benefit package, well, shoot, we're $65 a month, and you can leave both those with me. Yeah. Yeah, that one. Yeah. $65 a month per plan, and your patient has an on-call physician they can get in. There's no co-pays, there's no delays. This next group is one that we haven't really broken into yet, but there is a lot of potential there. These are large businesses that are self-funding their insurance. If you are self-funding your insurance, then a plan like ours, we come in, we are a membership plan, and we are preventing claims against your self-funded plan. And as a large business with a self-funded plan, that's really what you're trying to do, is prevent those claims from happening in the first place, so that this nest egg that you're using to fund your self-insurance plan goes over year to year to year, and your rates don't go up. And that's the whole reason you have a self-funded plan in the first place. So that's a group that stands to benefit. And then any business, you think about the time loss benefit if your employees are able to get in and see a physician same day. You know, if they're not out sick for days, finally get into the clinic, and when they get into the clinic, they're not waiting hours to get in, be seen, go to the pharmacy, pick up the prescriptions, et cetera, et cetera. So from a time loss benefit, any business could stand to benefit. So where are we as a company right now? So we opened up in 2014. It was just me and a nurse in Neosho. And we now have 4 full-time physicians. We've got one of them with us today, Dr. A, if you want to wave to people. There you go. Dr. A joined our clinic in October of this year. He took the place of Dr. Eddie Hansen. Dr. Hansen was a fantastic physician. The only problem with him is that he left us. So we are very excited to have Dr. A here. Dr. A is highly, 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 highly trained. He is unique in the primary care world with the skills that he has. He's soft-spoken, he's wise, he's kind, he's easy to talk to. He's a fantastic family physician, so we're grateful to have him. In Neosho, we have Dr. Benson, Dr. Matos, and I've stepped down as a doctor to work on scaling this company. All right, so where are we trying to go from here? So we have 3 physicians that we're trying to fill up their patient panels, and that we're trying to grow here in the Joplin location. We have a couple of the communities that we're trying to get into. It's been interesting. I own an insurance clinic here in Joplin as well, the Cornerstone Clinic. And there was one community that we were looking at building a free market position in, that after we talked to every business in the community, we realized that the community is such a high preponderance of Medicaid that we just don't serve them. People don't want to pay a membership fee, so we're actually putting one of our insurance clinics there. But we're working with a couple other communities right now to put in a free market physician clinic. And so that's where we are as a company. What are our challenges to ongoing growth? Like the big thing is consumer education. Like if we understand what health insurance is, how it should be used, and how people could be saving money and getting a superior product, we wouldn't have any problem filling our clinics with patients, but getting that education out there is a challenge. And the other, kind of the big thing there at the bottom is we're running a little bit cross-culture right now. So helping people identify companion products to what we offer so they do have proper health insurance so that they don't go to the hospital and get destroyed financially is a little bit of an issue. Early on, we had a lot of people that just said, hey, I've got my doctor, that's all I need, and they wouldn't get a high deductible plan or a Christian healthcare ministry plan or anything like that, and they would get burned financially despite our telling them, hey, you need something on the backside in case you do have that heart attack, that stroke, that hospitalization for pneumonia, whatever it is. And so working in the community to get those companion products is a little bit of a challenge. You know, we're having our management challenges like any growing business, making sure that we have quality control across multiple sites. And then just me as a businessman learning the things that I didn't learn in medical school. I'm working on my how stupid I really am. Yeah, so it's been good. I look back like, oh, I could have saved years of pain with some of these decisions. So that's where we are. So I asked Lowell kind of what is it that the purpose of this is, and he says, well, how can 1 million cups help your business? You know, where consumer education is our biggest struggle, you know, any opportunities to present anywhere, we love that. You know, ING has been generous to us. We're part of BNI. You know, we present at Rotary clubs and things like that. So if you're part of an organization where you need a presenter, we would love to come and talk about the proper role of health insurance and how people could make healthcare personally affordable to them. We are moving into some new markets, and so we are looking for potential investors for that. We have some kind of exciting things happening outside of the state right now that we're looking for some funding on. And then any introductions to businesses that could benefit from utilizing our services, we're always excited for that. That's really kind of one of our big target markets is these small businesses that could use our services. Or if you know one of those bigger ones with a self-funded plan where we could go sit with them and say, okay, this is a complex critter, but you could be saving tons of money by using something to protect your nest egg in your self-funded plan. So that's what I've got. Questions? Lowell.
I have two I was just thinking about. So one, can you talk a little bit more about, because I mean you just briefly hit it, but on the x-rays and prescriptions and all that kind of stuff?
Yeah.
I know that you do it at cost, but might explain that a little bit more?
You betcha.
And just give some examples?
Yeah.
But the other thing then is, you say you have access to a doctor, all that, but what are some limitations? I mean,
Yeah.
there's some things you don't do or
Right.
can't do or that kind of thing.
Right. We don't deliver babies in cars. So the labs and the meds and the x-rays and things like that. So labs, when you cut the insurance out of it, are really quite affordable. So an adult lab panel, let's say you're getting a cholesterol, your average blood sugar, and your liver and kidneys, and your blood counts and a thyroid, that would cost you a total about $30 at our clinic. And so our patients have access to those at-cost labs. You know, if you're someone that has to check your INR every couple of weeks, I think it's $6. If you're someone that has to check your A1C for diabetes every 3 months, I think it's $5.50. Medications, we do sell medications out of our clinic. We don't have any controlled medications. We don't do much with name brands, so they're all generic medications. In general, the Walmart $4 list costs maybe $1 or $1.50. So that's about the prices you're looking at. Now, we are working at partnering with cost plus pharmacies in some other settings to just have our clinic and the cost plus pharmacy next door and just have the two working together. We're not necessarily trying to be a pharmacy. In fact, in our other growth plans, we're trying to bring in one of those there. But those are about the cost of those. If you're needing imaging studies, in most communities there are affordable cash imaging options. And that's the case here in Joplin with downtown imaging, where you can get an x-ray for $50, you can get a CT scan for $400, you can get an MRI for $500, you can get an ultrasound for $150. So in each community, we try to partner with an organization like that. We don't need to duplicate that or undercut them because they're already providing that service. What do we not do? We're family doctors. We're pretty broadly trained family doctors. Dr. A is unique in that he has some remarkable surgical experience, and so in-office surgeries, I would suspect that he's maybe in the Joplin area, maybe the highest qualified in the Joplin area for those in-office procedures. We don't provide prenatal or maternity care, so you want insurance for that. But we do pap smears, we manage diabetes, depression. We don't put stents in your heart, but after the fact, we can manage heart disease. We manage cholesterol, we can take care of kids, we can take care of adults. We try to be fairly broad-minded, and in the medical world, if you're not part of a system that's making you see 6 or 8 patients an hour, you have time to figure things out, not just refer out to the endocrinologist every time you see the word thyroid disease or diabetes, something of that nature. So yeah.
What kind of procedures?
What kind of procedures, Dr. A?
Yeah, so we do minor procedures like skin bags, a growing nail, lipoma,
with local anesthesia and with very simple treatments. Yeah, I have done some of these since I was hired in October, and it was successful. And thanks God, no complications happened.
He's done a number of things that the rest of us kind of, we're all kind of cowboys in the medical world, but it was a little too cowboy for us. Yeah, I think there's a hand back here.
We'll answer.
We'll
That's
answer.
the first question I had.
Yeah. Go ahead.
Okay. Do you do, like you said, depression, do you do like anxiety meds, or what about like weight loss and stuff like that?
We do. Each doctor kind of has their own flavor, you know, where we try not to say, well, you can do this, but you can't do this. So each doctor kind of has their own flavor, their own approach on it. So we have some that are using weight loss medications more than others. And so a lot of times the patients are finding the doctor that's kind of more philosophically aligned with them and choosing that. So yes, we do those things. Yeah.
I think one of the challenges you'll have with larger companies is the things you don't do, like maternity, cancer, like those kind of ongoing, real big kind of stuff. So I think the education that you can provide to those larger companies is, here's what we do, here's what we don't do, here's how you get what we don't do covered.
Right. And so you have to select the right product for that. And we, a lot of these things, we've got a female provider that works part-time for us that comes and does a lot of the women's health needs, the pap smears and things like that. We're trying to bring more of that in, but you're absolutely right, you have to make sure you got the right things so they don't have any gaps in the coverage. Jennifer?
Would Aflac be a good companion insurance for what you've got?
Aflac, if you have it with something else, because Aflac, you're gonna get that initial payment when something happens, but it's just a fraction of what that potential cost is gonna be to you if you're having a stroke or you're actually hospitalized. So Aflac is great to cover maybe that deductible. So if you use Aflac with a ministry plan or Aflac with a high deductible plan, then Aflac kicks in to pay that deductible for you, and then your insurance covers the rest. Yeah, great question.
I also had a comment. You guys have done a lot better on this last go round of pamphlets, but I had talked with Karen a couple of times. For the general populace, like my people, I want to be able to give them a pamphlet that says, hey, you can come here and get stitches, you can come here and get this, listing out all of the things they can use that for, because I think it's the general populace is kind of doesn't quite grasp everything you guys do that would apply to their lives.
Right.
And especially the younger people. But if they know they can come in here, go in, they've got a throat problem, they can go in and get antibiotics, or they can go in and get stitches, or just listing out those things on your pamphlets to give for employers to give their employees so that they can see all of the benefits that they would actually get.
That's good feedback. People keep telling us, and I don't think I've realized that the employers are looking at it and saying, well, they don't cover the thing that I need. Okay, thank you, Jennifer. We'll take that to heart.
Okay.
Yeah, very good.
Two-part question. One is, do you know how much the insurance industry is spending on lobbyists? And second part of that question is, whatever that answer is, are you concerned that at some point in time when you're on a national radar, that those lobbyists and the insurance industry will try and target this system?
Yeah, so far the system's been flying under the radar. We're one of probably 1,500 clinics now in the country. So they're all mom and pop shops. The struggle has been taking this and achieving any sort of economy of scale and scaling it, which is kind of the nut we're trying to crack. How do you turn this from one brave doctor opens it up to a company that can hire doctors that are passionate about it but are not entrepreneurial minded? And so it's dangerous. Luckily, so much of the regulations on this are state by state. So there's states like Missouri that are friendly to these clinics, and there are other states that are not. And so luckily, we kind of just pick our battlegrounds and go to the states where it works. But yeah, my retirement plan, it encompasses the idea that my business could disappear like that. Yeah.
Okay.
Yeah. One stroke of legislative pen, we could
last thing is, it's been a pleasure watching you over the last few years because you're a great example of what free enterprise truly is and what an entrepreneur-minded physician can be, and just utmost respect for you and what you're doing.
Well, thank you, and we'll keep it that way, because I won't show you my books. Yeah, it's not as good as it looks, but yeah.
When you're talking about growing, and I know you're talking about growing the family medicine portion of your business to different communities, is there, and I don't know the medical laws, so like, slap me on my wrist if I'm just like way out of line here. Is there a possibility to scale to where you could offer more specialized services?
Yeah.
There is.
Yeah, there was, it's been tried a couple times. There's theory that if you have 7 primary care physicians that you can support, a cardiologist, a general surgeon, they listed several specialties. And so in Las Vegas, there was a group that got a bunch of outside funding to go ahead and put this all in place at once. But it went under before the primary care doctors could get it up. Once again, that consumer education part. So they had everything in place, they had the funding in place, but the patient acquisition took so long that it went bankrupt before it could achieve the support of the specialist. And so, I mean, wouldn't it be wonderful to have a cash hospital with affordable pricing? Absolutely. And the cash surgical centers are starting to become more and more popular. The leader in the country is the Oklahoma City Surgery Center. They are the national leader in that. But yeah, there's that thought of doing that, but until we get a little better at the scaling of the primary care doctors till you can get to that point, it hasn't been achieved yet.
Okay, but it is a possibility.
Absolutely, and it's very desirable, you know, that we could create a full-on system that would work.
Follow-up question. You have teenagers, so you are very in touch with the Gen Zs and Gen Alphas and all their fun tendencies. And I do say that with like love in my heart because I do think they're fun, and I do think people are finding that younger generations have a more entrepreneurial mindset. With KCU here, do you see more of these young physicians being able and willing and wanting to go out of their normal healthcare systems and pursue something like this?
Yeah, I think so. One of the other hats I wear is I'm attending for the family practice residency here, and so I get to work with a lot of the residents and with a lot of medical students. And man, they are really open to new ideas, and I think they're open-eyed enough that they see the failures of the current system, and they're kind of an independent-minded group, and I don't know that they want part of it. So I think there's a lot of promise with them. Yeah, I think so.
Can I ask another question?
Yeah.
Sorry, I got a lot of weird follow-up questions.
Yeah.
Have you thought about going to local nonprofits like Economic Security, Lafayette House, even Children's Haven, and seeing if there could be a donor system in place for the residents there to receive care from your facility?
It's something that we have done, and we've got that set up with a couple of those organizations. It's something that would probably bear us pursuing a little more. Like a lot of those business deals, when you work with those entities, it's so slow to get it done that we usually go chase something shiny before we reach completion. But we have a couple groups we're doing that with. It would bear having us do it more. Yeah.
Right. Especially maybe instead of, not that the community clinic doesn't serve its purpose, but for people who are really trying to, like I think of like the Lafayette House, for example, people who go there and they're trying to get back on their feet, and the community clinic doesn't quite fit with whatever lifestyle they're trying to move into. But they still need very affordable care.
Yes.
Yeah.
Yeah. No, that's a great idea. And if any of you have any connection that you want to say, hey, talk to so and so, we'd be open to that. But that's something that, yeah, good idea. Yep.
I have another insurance question. So.
Okay, very good. I didn't know if that was the out of time. I felt
No,
it was
no, you're fine.
Yeah.
So the way I understand it, I think you told me this once, but, so you have catastrophic care, which is like hospital, all that. But then the other piece is the family physician and that part. So if you handle this part, then do you have any recommendations or plans, like in your back pocket, or you partner with, for just this coverage that works really well with yours?
Yeah, so of course, the Affordable Care Act killed most of those plans. There were some that hung on, so there was a space created for two types of plans in the Affordable Care Act. One of them was the healthcare ministry plans. So the healthcare ministry plans, most of them are affiliated with some sort of religious affiliation, and they are across the board. They're really high quality. If you're going to go with one of the old standards. There have been a bunch of them that have cropped up since the Obamacare took effect, and a lot of them that have gone bankrupt. But the old standards, Medishare, Christian Healthcare Ministries, Medishare is a little more expensive, and they do a little bit more on the paperwork side for you. Christian Healthcare Ministries is budget. They're doing more and more of the paperwork for you. They will now, Freeman bills them directly. So those two products are fantastic if you have a religious affiliation, if you're a churchgoer, and if you don't smoke. The other loophole that was created in the Affordable Care Act was for so-called short-term insurance plans. And so these short-term insurance plans are meant to last 6 months to a year, but they can be purchased over and over and over again. And I think it's state law that determines how many times you can repurchase it. The only drawback to those is that each time you have to recertify for it. So let's say you're on a short-term insurance plan, you get cancer. While you're on it, they're paying for your cancer treatments. But then when you try to sign up for it again, they're not going to take it the second time at the end of the year. But they do sell those plans. So if you're a young, healthy, short-term renewable plan is a good way to go on. And there's probably more than one group that sells it in our area. Kraft sells those in our area. And then the healthcare ministry plans you can get on chministries.org to get it, or I think there may be an agent or two in the area that connects people with them. Yeah.
You talked about having some opportunities to tell the community. One thing you just mentioned, church. I go to church a lot, but there are also a lot of people that comes to church and looking for those opportunities for families. And I know I'm leading a group of young adults, and having small families matter with 3 or 4 or 5 kids.
How are you going to pay for it?
And like, how are we going to be able to pay for this? So have you had any conversations or connections with church pastors or community leaders that can give you those speaking opportunities at all?
You know, I've been just a little squeamish to leverage the relationships that I have there, because and you can imagine, like, I don't want to. You try not to take business from your out of the church, but we have a lot of church staffs that have signed on with us, and so if you've got a small group that you feel like would be beneficial to speaking to, I would love to speak to them, and maybe that's something we pursue a little more generally. I hate to pursue a congregation that's identified as such.
Well, it's just more when thank you for saying that. I was thinking more of a small setting. So the community or people that goes to the church that is very interested into just hearing about the information to learn about, because they're like, hey, I just don't know what to do because I got 5 kids or 3 kids and only one working husband or wife, so to speak. So
and that's the goal. Healthcare, the product itself is something that could be personally affordable to anybody with a job. And so, no, I'd love an opportunity to do that and talk to people about that. Yeah.
I am inviting you to attend and pitch at the upcoming Pitchpalooza, which is our first real big inaugural pitch competition in Joplin. And it's in conjunction with Kelsey and Katie at the SBDC, the Joplin Chamber, and Missouri Southern State University. Cool. So we have 4 categories, and the one that would be perfect for you is scalability. And even though we're still working on sponsorships, we do have, at a bare minimum, the winners in scalability and startups will win a free membership in the Joplin Chamber for a year. That's new, and but you're a perfect example to present. And even if the winning, it's not the winning as much of it is as we'll have press there. The community will rally around this, and it'll be a great opportunity for you to share what you offer.
I love that. Thank you, guys.
Yeah. MSSUtraining.com. Click on Pitchpalooza, and you can register there.
Okay, I'll do it.
Yay.
Awesome.
Yeah. All right.
to work solely for benefits
Isn't that crazy?
and to pay for their health care.
Yeah.
I think they would be great people to come present to at like one of their staff meetings and just tell them about this. So if they're like, if they get someone in their chair going, it has to be full time because I have to have benefits, but they really don't have the time or energy or means to have a full time job.
Right.
Let's get them this as well. So you can have that part time job, work supplementing your workforce, and you get the benefits. And so if you're a single mom with kids and you need them to have health care and you're worried about them, and there's fear in your heart,
Right.
here's this as well.
Yeah.
Okay.
That's great.
That's good.
That is good, yeah.